Hi, my name is Roberto Rapalo. I tested positive for COVID-19, and I was part of the Precision Recovery Program for Mount Sinai.
Hi, I'm Chris Kellner. I'm a neurosurgeon at Mount Sinai, and I'm co-director of the Precision Recovery Program.
The Precision Recovery was great for me. I battled COVID-19 for 14 days, and not every day was it easy. It was a battle. I describe it as a boxing match, and every day was a new round. Luckily, I do have my wife that did help me, but there were days that, especially going between day 7 and day 12, I was just too weak. I was alone. It was difficult to even think properly if I should go to the hospital or not, and that's the scariest part. Thinking about your family, that you have to be there for your family. You need to survive this. But the Precision Recovery Program, I was putting my data every day, and that gave me confidence in the information the doctors would give me. They knew my data, they knew what they were looking at, and they knew how I was feeling. On the 2 days that I felt the worst, I couldn't get up, I had to call in and ask for Dr. Kellner his experience and his thoughts. And by him looking at my data and telling me that I need to fight this, I still need to stay home, but the virus looked okay. Just continue to try to eat fluids, drink liquids and eat fluids. It helped me trust in the information he was giving me, because I knew he was looking at my information and my data. Dr. Kellner, in my opinion, saved my life. He helped me get through this, because you cannot get through COVID-19 by yourself. And in my opinion, if it wasn't for the Precision Recovery Program, I may have drastically made decisions to go to the hospital, or maybe mentally I wasn't going to be able to beat this by myself. There is a mental component in trying to get better from COVID-19, and the Precision Recovery Program definitely helps in assisting with trying to peacefully, in your mind, understand that what the doctors are looking at is how you feel, and they are trying to get you better.
Yeah, everyone has a little bit of a different course with this virus, and it seems to present very differently in different people. What we're seeing with the patients reporting their data is that sometimes people are doing pretty well for a period of time, like a week or maybe 10 days. And then they might even start feeling better for a day or two. And then they'll start feeling much worse for a day or two after that. And so that's kind of where we caught Rob when he was doing a little bit better after his first maybe week or so. He started entering his data, and I had spoken to him initially, and he was pretty sick, but he was doing okay. And then a few days later, we saw in his data that he was having a harder time breathing, and he had fever again. And so we called him up, and I did a video chat with him and spoke to him, and he was much sicker than he had been a few days earlier, but he was still doing pretty well. And I think being able to assess him through a video chat and see how he was breathing, knowing that he wasn't having severe breathing problems. He was just having a little bit of shortness of breath, and kind of talking him through the criteria for coming into the hospital, giving him some confidence that he was still doing pretty well, even though he felt worse off than he had the day before. And then he had really a day of really severe symptoms there. He got through that, and then he did much better after that. He never had to come into the hospital.
So just exactly what Dr. Kellner said. He knew the disease process, and he knew that I did get better a little bit, and then for some reason I got worse. And that's the hardest thing to believe with any other virus or cold symptom or flu symptom. Once you get better in 3 or 5 days, you tend to feel better and continue to feel better. But with COVID-19, it is a long battle, and Dr. Kellner helped me understand that. He did see that in my data, which helped me understand that he really does know what I'm going through, and to really trust in him that I will be okay. I need to get myself together. And in a way, it was a pep talk, but it was a pep talk that was much needed. So the Precision Recovery Program, on a daily basis, I input my data, my blood pressure, my heart rate, my O2 saturation, and if I have any chest pains, any shortness of breath, any difficulty breathing, and every day I would put my data in. What's surprising about COVID-19 compared to any other disease, I mean, I've always been pretty healthy, is that it takes a long time. And you're surprised after 7 days that you still feel sick. After 10 days that you feel sick, you're surprised that you got a little bit better, but another wave hit you. And this is not something normal that anyone experiences. And being in that, you do need help. And the Precision Recovery Program allowed that to make me feel that I had people behind my back supporting me and watching every move I make and helping me get better when I need to. The main thing that helped me that day with the conversation was that Dr. Kellner described the fact that I did get better, but I was feeling worse, and he understood that, and he was seeing that amongst other patients as well. So it helped me feel that I wasn't alone, and if other patients did get better from this and was able to stay home, I could stay home as well and get better.
I think Rob is a perfect example of what most people are going through with this disease, where they do become significantly sick, and it's not predictable what's going to happen one day or another. As he's saying, you're used to getting the flu, or you're sick for a few days and then you're better, but this could be a little bit more of a roller coaster, and it's kind of unpredictable how it's going to go for each individual person. We're all still trying to figure that out as a medical profession. And so I think that it's hard when you go to an urgent care center, as Rob had, and really the instructions you're getting from the medical system are, if your symptoms get worse, contact your provider or call 911. But people are going to have this roller coaster ride of symptoms. And so they kind of need repeat assessments to know, yes, my symptoms are worse, but now do I have to go to the emergency room? And so we provide that expertise and medical consultation without having to go to the emergency room and expose yourself to other people that have the disease, or maybe spread the disease among other people that don't have it. And it just facilitates decluttering, really, of the emergency room, which is one of the main battlegrounds right now for this disease. And it's, I think the main goal is to keep people out of the hospital who don't need to go, and give them some assurance at home that people are still monitoring them even though they're not in the hospital setting. And then the other goal is to catch people at home who need to come back in. And that has happened a few times as well. We've had a few patients who we have checked in on at home, and they really did fit the criteria for coming in. And then we called the ambulance and got them to the emergency room, contacted the ER doctors to let them know this patient was coming, who was COVID positive. I think it's important to note that this monitoring is a once-a-day data entry by the patient. So it's not as if you're in the ICU and you're getting your heart monitored continuously. We can't react to an emergency. If something happens suddenly, you still need to call 911. If you even need an urgent MD visit, you can use an urgent care virtual visit like Mount Sinai now. But this is somewhere in between. This is where you don't need urgent care, but you've gotten slightly worse. And so we're monitoring your symptoms over a longer period of time. So this is not replacing 911 or urgent care, but it's creating a link to the hospital for the majority of people, which don't need those more severe ways to reach out to the medical system.
On the first Monday, I felt sick, and the following Thursday when I got tested. So after fitting urgent care, after leaving urgent care, you do feel a little bit empty inside. You kind of feel this is it. What if it do get worse? And in most diseases or colds or flus, you kind of feel in a day or two if you're better or not. With COVID-19, it can take a while. So days pass, and last time you went to the urgent care could have been 2 or 3 days ago. And at this point, you just don't know if maybe a lot of things have changed inside your body. Because then at this point, I felt some shortness of breath and some chest tightness. And at this point, you don't know if maybe what you feel now was what the doctor saw 2 or 3 days ago. And with the Precision Recovery Program, you do get a sense of a continuation from the last time you spoke to the doctor, even though you haven't spoken to the doctor that day. I'm now in day 16. I think I turned a corner around day 13 and 14. I now feel so much better. My cough has decreased. I'm able to take deep breath into my lungs now. And the chest pain hasn't been improving every single day. I think the most important thing is that once you turn a corner, I still input my data in. To me now, it feels like a safety zone to just input my data in case something happens that I don't feel so well the next day. Tomorrow I do have an appointment with the physical therapist of the Precision Recovery Program. Looking forward to catch up with her and to have any tips regarding to how I could continue to improve my breathing and the pain I used to have in my chest, just how to continue to improve with that as well. You don't have to fight this by yourself. It's a long battle. I never expected to be fighting a virus for 14 days, but the main benefit of the precision recovery program is that you do have people standing by your side fighting with you, and that's what will help with the recovery and with the mental aspect. By day 7 to day 12, I was mentally exhausted. I had my wife helping me to try to get better, but you do need as many hands as possible. And with the precision recovery program, where you feel at your worst, I was able to reach out and have people fight with me along the sides, including Dr. Kellner, who helped me at that day to just keep my head up and keep my feet moving and keep my body moving. Whereas, it was so easy for me that day to just beg and try to go to the hospital. But at that time, it wasn't the right choice. And when you're that sick, when you're that tired, it's hard to really come up with the right choice. And the precision recovery helped me make the choice for me. And with that, I'm very thankful for Dr. Kellner and everybody in the team to help me get through those dark days. And I'm at day 16, I feel much better. 2 weeks later, I think for everybody it will be a little bit different. In my case, I still have my symptoms monitored because I just started feeling better for the past 2 days, and I want to make sure that I continue to get better all the way up to 100%. I still don't feel 100%, but I think it's important to not have any fallbacks, knowing how COVID-19 was an up and down roller coaster from the first day all the way up to day 14. So my recommendation is to keep believing in the program and do everything you can until doctors finally say that you're good to go and back into society without having to worry about COVID-19.